Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. I'm Harold Fisher. With the new administration coming in January, there is a lot of concern about the status of vaccinations for children. Will they continue to be available? Robert F. Kennedy Jr. has been selected by President-elect Trump to serve as the Secretary of Health and Human Services. Kennedy has a history of speaking out against vaccines, although recent comments he's made have tempered his anti-vaccine stance. Well, tonight, we're going to try to break through the noise and discuss the facts about vaccines for children and more. My guest is Dr. Marilyn McPherson-Corder, pediatrician and pediatric family member with the Howard University School of Medicine. Dr. Corder, thank you so much for joining the conversation.
Thank you for having me, Harold.
Always. Let me share just some quick, fast facts with you. Despite the decreases, coverage with several vaccines have remained above 90% for children. That includes the poliovirus vaccine, measles, mumps, and rubella. This information provided, of course, by the CDC just this year, 2024. I want to ask you, before we get into some of the meat of this conversation, explain to people exactly what a vaccine is and how do they work?
Absolutely. Vaccinations, they save lives, first of all. And the need for vaccinating the population is just that, to make sure that these vaccine preventable illnesses are not taking us out, are not having its toll and causing morbidity and mortality. So we have several types of vaccinations. We have one that's a live vaccination, where you actually are getting the vaccine, and the vaccine is a live exposure to the infection or have be, and it makes your antibodies. So you're building up antibodies towards that. And that would be like polio. Polio used to be live. Now it's no longer live. But years ago, when we had the sugar cube or the liquid, it was a live vaccine. And then those people around, it was almost like a herd immunity, where folks would get the vaccination. And then those who didn't get the vaccination or soon to have the vaccination would also have some effect of the live vaccine. There are some vaccines that, if you have something called a immunocompromised system, such as chemotherapy, things that will aggravate that your neutrophils, which are your white blood cell counts, are low, you're on chemotherapy, you can't get the live vaccines during that time. So that's something that the specialists, the doctors, the oncologists, as well as the pediatrician have to address. In general, most of our vaccinations are no longer live. So what you're getting is what we call a boost of the antibodies, of the fighting cells that will give you protection. And that protection is necessary for if you have exposures to pertussis, polio now, diphtheria, Haemophilus influenza. And there's a host. Now, there's a list of them that even when I started practice back 30, 40 years ago, we didn't have all of the vaccinations that we have today. We had, of course, we did have the diphtheria, the tetanus, but we didn't have measles. So we saw lots of measles. We saw lots of mumps. And we saw the problems that it caused with some individuals, especially children. We know that mumps causes orchitis, which is interfering with fertility in men. We also know that different infections, such as meningitis, that we now protect against, can cause brain damage all the way to fatality. So I'm happy to say you're right, 93% here in the DMV, we score that with vaccination rate. But as you said earlier, there's a new administration coming around. And we already beginning to see an increase in surge of measles, even before 2025. And measles are preventable, but we're seeing it in different locations, and some polio, not to mention pertussis, which is the whooping cough. So you want to make sure that you talk to your doctors, let he or she explain what's going on and why it's important at the different stages. As an infant, it's 2 months, it's 4 months, it's 6 months. That's for a reason. That reason is that allows that protection to be there. And as that protection is building up, that infant is protected as he or she builds their own immune system. Then we
Mm.
have the update in terms of MMR, varicella. So I won't go through the details of when you get it. I would just say it is very important because we are seeing, and I have seen years ago, children suffering from those conditions that we now prevent by vaccinating.
Well, let me take it back because it is important, particularly for new parents to, or expectant parents,
Mhm.
to know, for those who may not, for various reasons, have not had that conversation with the pediatrician or the obstetrician.
Mhm.
So you said 2 months for the first vaccine, and that was for.
Well, we actually start, let me go back a little further. We
Go
start
ahead.
before the baby is born. There's something called a Tdap. A Tdap is the tetanus, diphtheria, pertussis, the P on the end, Tdap. So the grandparents, as well as the parents, expecting parents, should be updated because that's the pertussis that many people, yourself, myself, will get pertussis. That's the cough. And we survive it. I mean, our bodies are strong enough, our immune system. But an infant, a neonate, who is exposed to pertussis can have a horrific hospital course that can lead to lack of oxygen, that cough, we call it the whooping cough, that can also cause death. So we want those individuals, what the OBGYNs are now saying to the expecting parents, make sure the grandparents, make sure yourselves are current in the TDAP. We typically talk about that when you're going to college and you get that as you get registered, but many people, it wanes off. It's 10 years and it's gone. So by the time you're a grandparent age or even expecting parents, you don't have that protection. So that's pre baby delivery, that's pre birth. Then once the baby is born, the very first vaccination that they get, even in the hospital, Harold, is something called hepatitis B. That's
Hmm.
before they go home. So that's the beginning of, even before 2 months, that's the beginning of the primary series of vaccinations.
Okay. And then continue with
Right.
the other progression because I think it's really important for new parents to know this. My baby is 26, and so I've forgotten these things, and I don't think I'm going to be a grandparent anytime soon. So please continue.
And you got to make sure when you are that you get your Tdap. So from the very first birth, they get the hepatitis B, and that's nationwide, and that's in the hospital before they even go home. So that's the beginning of your vaccine series. Then the next set of vaccinations are usually at 2 months. We have a few combination vaccines where at 2 months of age they get the DTaP, they get the polio, and they get something called a hepatitis B. And we have formulated that all in one injection. So we've cut back on the numbers of injections. However, we still have the protection.
Hmm.
Also, at 2 months, you receive a pneumococcal. We call it Prevnar, but it's a pneumococcal 20. And that's the pneumonia protection that you'll hear babies get, but also for seniors. You'll hear commercials saying seniors should come in for their pneumonia shot.
Hmm.
And by the way, right now we're experiencing lots of pneumonias, including the walking pneumonia term that we see
Yes.
a horrific increase that we hadn't seen in a long time. And
Hmm.
for daycares and school age children are seeing that mycoplasma pneumonia. But going back to what else you get something called a HIB, Haemophilus influenza B. Now that's the vaccine that helps prevent ear infections as well as meningitis. So there's those series that's at 2 months, 4 months old, and 6 months. So that's your primary first 12 months of vaccinations. Now, I know it's frightening. I understand. And in my practice, what I have allowed parents to do is if they want to space it, instead of getting those 3 injections at one time, because, talk to your doctor. It's okay if they need to space it and then 2 weeks later get another one. But it's so very important. And I have seen too many patients, even recent, who had not gotten their vaccinations on time or at all suffer from the preventable illnesses that we're speaking of.
Yeah. I remember the sugar cube. I remember in elementary school
Yes.
the the big ray gun looking injection device that all of us had to line up and take. It was very, very quick. And I can't say that I know anyone, even during the summertime, during short sleeve times, tank top times, and beach and pool times, anyone, any adult, even if it's a very young adult, I've seen that vaccination um,
Scar.
scar. Thank you. The vaccination scar. Everybody has it.
Hmm.
Why do you suppose that there seems to be this resurgence of skepticism
Yeah.
about vaccinations, even from those who have grown up with them and as a result have not had any of the diseases that those vaccinations were designed to prevent?
Well, that's a twofold question, Harold. And myself, as a woman of color, Black woman, we need to make sure we address that in terms of the skepticism, the non-trust. We talk about the Tuskegee experiment. A lot of folks, especially minorities, they're like, you know what? I don't trust it. I don't understand why we need it. I'll take my chances. It's going to cause brain damage. It's going to cause autism. It's going to cause, how do you know that's what that is? And I can address, I can understand that. I can understand it wholeheartedly. And what I say to them is this, and we talk a lot, and I have information sheets that I pass out for each vaccination because education is important. Knowledge is power. And I say, I understand, but here is what happens if you don't get it, and here are your chances. And some people say, well, we don't see that anymore. Well, there are people here, especially here in the DMV, who didn't grow up here, and they're coming over from places that will have a high rate of these vaccine preventable illnesses. So you could be wherever. You could be in Starbucks. You could be, Black Friday shopping. You could be wherever in church, and they have it, and you have been exposed. You could be even in the urgent care. So you just don't know. And I tell folks who are, concerned, I let them know we no longer have this in it in terms of with the mercury and different things. We address it and we talk about it and we say, right, you may have had measles, but this is what measles can do. You may have had chickenpox, but this is what chickenpox can do. Reason why they give the vaccine. I was coming through and we got that. And we got chickenpox, and we're like, okay, let's go over so and so's house because we're going to just get the chickenpox party and get everybody out the way. But unfortunately, chickenpox can cause problems with the skin that can lead to infections, including kidney and renal. So we now know what happens, and I address it, and understandably, but this is what we have had mandated, and I hate to say the word, but it is required right now. Now,
Mm-hmm.
I'm going to add to that, we don't know what's going to happen in 2025. And it's a little bit frightening to us who are members of the American Academy of Pediatrics, as well as the AMA.
Hold
Because,
that point,
yes,
Dr. Porter, because I do need to take a break, but I don't want you to forget it. And I want to continue this conversation on the side after the break. Don't forget, you can hear this in every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is next. That's on WHUR. I'm Harold Fisher. This conversation continues on Sirius XM, channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM, channel 141. I'm Harold Fisher. We continue our discussion about breaking through the noise of conspiracies and discussing the facts about vaccines for children and more. My guest is Dr. Marilyn McPherson Corder, pediatrician and pediatric faculty member with the Howard University School of Medicine. Before the break, Dr. Corder, you were talking about those in the pediatric community who are concerned about the prospect of changes.
Absolutely. And it's frightening because we're not sure where we're going to be over the next 4 years. And as I said earlier, I'm concerned if we begin to see, as we have and see even more, a resurgence of vaccine preventable illnesses. And there's two reasons. Number one, we don't want those illnesses to come back because we've already made strides and success and have eradicated it practically. And here we are again because of some individuals, or even now the new administration will say it's no longer necessary. Now, I know as I've spoken to my parents, newborns, and those that are breastfeeding will say, well, I'm giving he or she my immune system, because I'm breastfeeding. And that does play a part. And that, because when you're first born, your immune system is pretty much not there. It's not yet developed. It takes 3 to 4 months for it to build up. So, of course, I recommend breastfeeding all the time anyway for those parents, be it, skeptical of vaccines or not skeptical, because that is the best milk you can give your child, the best thing you can do for your child. But there is some passive immunity that can go from the mom's breast to the baby. And I understand that and respect that. However, it doesn't protect you thoroughly and completely. And a lot of times I'll get a conversation that will say, well, my child's not going to daycare. My child's going to be at home, practically in a bubble. And I'm like, well, who else is there? And it may be a sibling who's in school, or a dad who's out working, and they may come in with a little bit of a cough, but then exposing the baby, they're not going to wear a mask all day and all night at home. And the baby response to those illnesses are a little bit interestingly scary. When I say that, I just had a baby who we just discharged out the hospital who had meningitis. And the meningitis, turns out, it aggravated the child's health, the newborn. The baby's a week old. But the brother is 3 years old. So he's out and about. And he's coming in loving up on his sister. Now, mom's breastfeeding. So that's why the illness didn't totally succumb and totally overwhelm the baby. But the baby was exposed. And those symptoms may not be a high fever, just maybe a little bit less eating, a little more sleepy. And those are all we got. So you got to put them in, you got to hospitalize them, test for everything, including a spinal tap. And that's a lumbar puncture. So if we could make sure that we protect, our most vulnerable, not only the infants, but even the seniors.
Yeah. Yeah, it's so important. Talk to me briefly, if you can, about life before the measles vaccination, before the polio vaccine.
I have to take a deep breath on that because I was already a clinician before the measles vaccination. And it was measles, mumps, and rubella. And we call it the MMR, measles, mumps, rubella. And we now get that at 12 months, and we get it again at 4 years old. We saw measles, the high fever, the rash, the lethargy, and also can cause brain damage. I can recognize measles. I mean, I'll never forget what it looks like. In training there at Howard, we ran clinics, etc. And it's very serious. And you want to make sure that you identify and hydrate and treat. Mumps, you want to make sure, and that's where you get the big parotid, the glands that swell up. You look like a frog or what have you. And that's serious as well. And it's more serious in males because it can cause infertility. And there's something called mumps orchitis, where the actual scrotum gets irritated from that virus.
My father had the mumps. I remember I was a kid. I was probably in 3rd or 4th grade. And I remember that my father was very uncomfortable, and he looked, keeping in mind that this is me remembering through a child's eyes. I remember that his lower face was very fat.
Yes.
I don't know about any other discomfort that he may have been having at that time, but I do remember that he was sick for quite a while, several
Hmm.
weeks,
Hmm.
and and it certainly was concerning for me. And he was an adult.
Right. And now the other thing, and of course, polio, I was already vaccinated as a child with polio. That's the sugar cube. We lined up, as you said, and then after a while it was liquid. Polio is a lot. That was when it was a live vaccine, and it took away thousands and thousands of cases of polio that prior to that vaccination people were experiencing and crippled, as well as died. So that was a good thing. Then now we're seeing some resurgence up in New York and the area of place where they're anti-vaccine community. But I also want to say this, Harold. My very first day in private practice, I saw a toddler who had a high fever, bulging fontanelles, actually, and that's what they call the soft spot, high fever, and he was lethargic. He had meningitis. And I'll
Mhm.
never forget that because I do remember growing up. One of the reasons I became a pediatrician is because my good friend died of meningitis. On Tuesday, on my Sunday, she had a headache. On Tuesday, she was dead. And I remember telling my parents, I want to be a doctor. We got to find out how we can treat this and recognize this. Well, lo and behold, my first day in private practice, I had a case. I recognized it because I got good training there at Howard, and we put him in a hospital, hydrated him, gave him his antibiotics, etc. And I saw multiple cases of meningitis. That was before the meningitis vaccination. And now we have the Haemophilus influenza, different vaccines and primary age that prevents meningitis and ear infections. But one of the side effects is deafness, brain damage, as well as death. We don't see that anymore, but you want to be able to recognize it. And one thing I was telling the medical students the other day, I can recognize it because I used to see it. But the younger
Mhm.
doctors have to make sure that they not just see in a picture, but really recognize it and think about it in the forefront. This may be this as opposed to a virus. And that's also what's scary.
What impact do you believe that here we are many generations after the the polio vaccine, measles, MMR, et cetera, where you have parents who are under 40 years old
Mhm.
and do not know anything about these terrible diseases? And do you think that because they don't see it, that this may have have an impact on whether or not they believe that the risks are still there?
You hit it right on the nail. It's like they've never seen it. So what how can you fear it if you haven't seen it or even talked about it? Now the generation, their parents may talk to them, the grandparents, or may not. And that's where the clinician has to make sure the PCP, the primary care, to educate. Because if you haven't seen it, you're not going to fear it like those of us who've seen it, who've seen children and grown-ups after the fact. I had a case where I gave a baby a polio. Well, you have to, that was the live polio. And you have to make sure that you tell folks who are immunocompromised, if grandma's on chemo or whomever has HIV, they cannot be around that baby. Well, that I know a case where the mother died because she was HIV positive and she was changing the baby's diaper, etc. So you have to make sure that you know the status of those who are in the household with the live vaccines, as well as knowledge. And as I said, beginning of the show, knowledge is power. You have to empower them. It only takes a few minutes, even if it's your it may not be the doctor, it may be the nurse, the MA, but that you drive it home. You drive it home. You don't want someone to say, "If only I knew," as their
Mm.
child is dying from meningitis or what have you. So it's on us. It's the village, and we have to make sure that we understand it's not causing autism. Autism have been vaccinating uh, vaccination causing autism have been debunked. I'm concerned with the guy that's coming in running HHS because apparently there's he doesn't believe science, but he believes that there's some affiliation, and he's not clinical, and that really bothers us who are clinical, who have years, decades of experience.
Yeah. Are there any special circumstances under which a child cannot be vaccinated immediately? For example, I don't know. What about a
Right,
premature baby?
right. Good questions. So there's something called, premature, extreme premature, and those babies are not ready to be vaccinated. We end up giving them something called RSV. There's a respiratory syncytial virus that is just not new since 2 years ago. That's been around for 30, 40 years. RSV, which is a bad cold. A premature baby is more susceptible because they don't have that fight back. They don't have that strength in their respiratory system. So there's a vaccine that they get called RSV vaccine. Now, going back to the regular vaccinations, we wait till they're a certain pound in terms of weight, certain age, to make sure that that vaccination that we're giving them takes hold, as well as they're ready for that. Often they're in the hospital for maybe 2 or 3 months anyway before they even leave. Sometimes the doctors there at the neonatal, what we call the NICU nursery, will give them that very first vaccine, maybe at 3 months, depending upon. So we individualize each case, Harold, and that's
Mhm.
important. It's not mass. Everybody gets the same, all one size fits all. No, no, you individualize it, and that's how I was trained. But you still promote proper vaccinations, even if it's a little delayed or customized to that child.
What about vaccines for older children or teenagers?
Yes. So, we get the primary vaccines 2 months, 4 months, 6 months, 12 months, 18 months. By 2 years old, you're updated until 4 years old. And that's when you just get your repeat measles, mumps, rubella, and tetanus. From 4 years old to 11, that's going to be your preteens. You're not vaccinated because you've had the primary vaccinations, what's required. Now, teenagers are a different group. Once they become a teenager, it's almost like they're toddlers again. They're sharing everything. They're sharing body fluids. They're drinking behind each other's soda. And that's where you can see cases of meningitis. You see cases of meningitis B on college campuses. I have I
Yes,
have heard and know four families. I won't mention names, but
of
four
course.
families who, the child went away to college, had a headache. 3 or 4 days later, the roommate found them lethargic. They're dead. And that's why we're talking about meningitis B, which is what you get at 16 and again right before college. We're talking about the other meningitis that covers everything but meningitis B, the ACO. And those vaccinations start at 11 years old. Now, 11 years old, you get three vaccinations, Harold. You update your tetanus. Remember, we said that lasts a certain time, but that's your Tdap. The P part is where that pertussis, but just so your tetanus and diphtheria. You get your you also get the papilloma virus. Um, we call it the Gardasil. And when that first came out, that was only given to girls. And I said, you know what? That's boys and girls, and that's ideally before they begin to become sexually active. That's why they chose
You're
11.
talking about HPV, is that correct?
HPV, exactly.
HPV, yes.
HPV. And now we give it for males and females. And you usually would just get two. The first one at 11 and 6 months later. But if you wait till you're 14 or 15 years old, if your parents wait, you have to get three of the HPV. Now, what does that do? That prevents human papilloma virus from infecting not only your genitalia, but your mouth. I've had several dental friends of mine who've diagnosed HPV in the mouth.
Hmm.
I have one. I know of two fatalities from HPV of the mouth. And I'll never forget one young lady was a friend of my son's, and she was PhD. Wasn't sexual. Well, she wasn't that way sexually active, but she died of HPV, and that's certainly something we need to address. Cervical cancer has now, whew, have pretty much decreased to the point of very rare. I mean, we still see cervical cancer, but it's been identified as HPV has been identified as the causative of cervical cancer. Over the past 15 years, we've been given vaccination against H, H, HPV, and we see a market decrease in cervical cancer. So,
That's so that sounds really quick to me,
yes, mhm.
because I remember, as you said, about a decade or so ago, a lot of discussion about vaccinating against HPV and its connection to cervical cancer. And I think what begins to happen is that as these as these medicines, let me just keep it very basic, as the medicines become more effective, we hear less and less about the diseases that they are designed to protect against. Because this conversation that I'm having with you, even in this capacity of a discussion about news and information, I can't remember the last time that I've heard anything about cervical cancer, but I do remember 10, and as you said, probably even 15 years ago, that it was a very, very serious health concern.
Especially in Black women, and we
Mm.
now see such a market decrease, and to the point they have expanded or they've realized the efficacy of the HPV vaccine is not just 11-year-olds, up to now 35-year-olds. And that makes a big difference, because before, once you were 21, 22, we were told, well, it's not that effective, and people were like, oh man, I just missed it. But cervical cancer is right there. You still have your cervix, and you're still
Mhm.
sexually active. And unfortunately, many people, millions, are exposed to HPV, but some people discard it in terms of it doesn't stay there, and some people's system, as we all are individually unique, some people's system allows it to begin to deteriorate and cause cells to change to cancer cells, and who knows who that's going to be.
Mhm. Mhm. What side effects should parents be concerned about when it comes to those early vaccines? And I'm talking about those side effects that will go away, but certainly that is a concern for anyone getting any vaccine. From even if you get a flu vaccine,
Right.
one of the side effects is that your arm is going to hurt. So,
Yes. And it's important to explain that to the parents. I do it even before the visits that they will be getting vaccinations. I call it my anticipatory guidance, to say the next visit is only going to be whatever, be it weight check, make sure they're eating fine, etc. But the visit on, and I give them information sheets, what we call the vaccine information sheets. And prior to giving the vaccine, I would say you want to make sure you watch for fever. That may not come that same day, but monitor for fever 2 to 3 days, up to 72 hours later, irritation on the site, some swelling. But you also want to make sure that you tell them, the baby may be a little cranky, but still should be eating, still should be active when they're awake, for different things. I've not seen an adverse reaction um, in a while. I remember one or two patients, the fever was so high. I'm like, look, please give Tylenol. You know, I'm not just saying put the child in the tub and and get the temperature down. Do Tylenol drops and monitor. Have a thermometer. Everybody in my practice, I'm like, look, if you have a baby, you need a thermometer, you need Tylenol, you need my phone number. Okay,
mhm.
those are your three things, and to monitor that. Once they know, and you let them know ahead of time what to expect, um, to make sure that they expect it, and if it's anything outside of that range, that they call you, and even call you within that range to make sure they're on board. So you want to make sure that you tell them, look, the vaccinations are important, but they do have side effects, and you want to make sure that you monitor that. Some daycares in the area will say, don't bring your child in that day when he or she gets the vaccines, because you want to monitor the child, which makes some sense. Um, But one, I want to say before you vaccinate, and I have seen patients come in and they're coming for their well visit and they're coming for their physical and their vaccinations. And once I examine them, I'm like, no, we're not doing this today because little one is having a little fever. Little one looks like he or she has a virus. They may not be physically fit for that vaccine that day. And the doctors are, we typically will say, not today, let's do this and that, treat whatever, be it ear infection or what have you, and give it 2 weeks. So you have to make sure your child is healthy. And a reputable doctor would check your child because you're not just coming in and they don't look at the child and you're getting a vaccine.
I did want to ask you about something that has less to do with children and more with adults. There's been so much conversation about shingles.
Yes. Yes.
And can you just take a moment to explain what that is and the role that the vaccine, the double vaccine, the 2 vaccines that you need, plays in preventing it?
So those of us who are of a certain age had chickenpox. Okay. So if you've had a varicella vaccination, you're not going to get shingles. Shingles is due to having had chickenpox and the lesions, the spots went away, but your body is still your body, and that virus is still dormant in your body. And after a certain age, usually 50, 60 or so, it surfaces. It comes back, and we call it in the dermatomes. It's chickenpox, but it's not the head to toe rash. What it is a very painful, and it's usually just in a linear line that's related to your nerve root, and we call it the dermatomes. And it's very painful. You can hardly move, and it's like chickenpox. I call it chickenpox on steroids, like chickenpox super, but it's contained in the area. But you're out of it. When I say you're out of it, you're very uncomfortable. You had pain medicine, warm compress, Tylenol, what have you. So the shingles vaccination is what the recommendation is, which we didn't get the varicella, the chickenpox shot, because that's for a certain age group. But because we still have chickenpox in our system, okay, and who knows who's when it's gonna surface, the prevention now is to get the shingle shot.
What if you don't know whether or not you had chickenpox?
Call your mama, call your cousins, so some people say, well, should I get blood work and see an antibody? But if you're a certain age, you may not have gotten it that you remember, and you may not see that 1 or 2 lesions, but a certain age group, you've been exposed.
Mm-hmm.
Okay.
Yeah.
So that's why even with the pharmacists, you can go to CVS, the pharmacy, and say, what's the age limit? I think from born 1962 on back, or, or even in the 80s. So there's with the pneumococcal 23, which is the pneumococcal for seniors, as well as the shingles for seniors and the pertussis for seniors. So those are the vaccinations that, as we go on the other side of the age after 50, that we're recommending, because that's another vulnerable population.
What do you say to parents who decide that they don't want their children to be vaccinated, even before they have children or immediately thereafter, and decide that they are going to go the holistic homeopathic route to deal with any of these issues?
Well, I'm going to say what I say personally, and I'm going to say what I say generically. Well, personally, you won't be in my practice.
Okay.
And I say that because it's a private practice. And I rather you not be in my practice and expose those in my practice as they're sitting in the waiting room. I don't want them exposed to an anti-vaccinated, vaccine preventable illness. But I educate them. Now, I've had some who've said that to me. I don't want any more shots, or I don't want, and I talk to them. I don't really want to say you can't be here, but I explain, what is it about the vaccines that you want to sign this waiver or don't want it? And a lot of times they just don't know. And I have to show them pictures and talk about stats in terms of if your child gets this illness or this vaccine preventable disease and virus. Then many of them will say, I'm banking on the herd you know, herd vaccination where the whole community
Oh,
and my,
herd immunity.
the herd immunity where it's like, okay, everybody else is getting the vaccine, so I'm going to be in that group so they won't get it. And that's to a point has some validation. That's, you know, but it's not true immunity, and that can wax and wane. So if everybody else, I'm not going to get it. But again, that can wax and wane. You let your child go somewhere else, you know, Disney World or what have you, where you see lots more children and that exposure is there.
Yeah. Final thoughts as we enter into this time of uncertainty. I mean, this is December, and inauguration is next month. The Senate confirmations will be starting shortly thereafter. For parents who have newborns and are concerned, what do you tell them?
Here's what I tell them. We do have a lot of uncertainties. And one of my main uncertainties is even with insurances. So right now the insurance is paid because it's mandated for your vaccinations. And those vaccinations are costly. Some of them as high as $250 per one vaccine.
Wow.
So everybody, all the insurances, no matter what it is, Medicaid, all of the insurances pay because it's mandatory. It's the CDC, it's the FDA. But my concern with the new administration, if they do say it's not necessary or you can opt out or it's recommended but not mandated, then you know what's going to happen. The insurance company is going to do this. I'm not paying for it. It's on you. So it's going to be pay out of pocket. And many people can't do that. Some can. Some can, no problem. I can pay whatever it costs. Okay? But they're costly. And some cannot. So what will happen, hopefully not, but as I'm hearing this new guy who's going to be over HHS, he's an anti-vaxxer. And I know what that means. Last year alone, 2023, measles cases surged worldwide 10 million. Worldwide. Okay? That means that's not unusual. But here it is you don't see it like that. But we will see it. We will see meningitis. We will go back to medicine in the 60s and 70s. And I'm fearful of that. So we are praying and we're hopeful that it won't come to that where it's no longer not only available, but costly. And then we can hold our breath and we can walk through these next 4 years in a sophisticated, modern medicine, safe medicine manner.
Okay. Dr. Marilyn McPherson-Corder, thank you so much. Always a pleasure talking to you. I really appreciate it.
Thank you, Harold. Nice to see you. Stay well.
Yes, indeed. That is the Daily Drum for this Monday, December 2nd. I'm Harold Fisher.